You can start
think,
your.
sorry,
Oh, are you there, Dr. Madhurahan?
Yes, there was an interruption with my connection. I think I have almost completed. So what I wanted to summarize is, more than achieving anything, I feel we were there with the patients and their relatives when there's no one and when there's no hope. We were able to control their symptoms and give them a peaceful and dignified death. So that's what I think we should try to achieve through our this training. And I'm happy to see our teacher and mentor to this palliative care, Gayatri Madam, is there. I think she said that when we were leaving from the Hyderabad to update with the things whatever we are doing. I think her teachings are in practice now. I think she will be happy about that. Thank you very much for the teachings, and thank you for the international experts for the support throughout.
Thank you, Dr. Madhurahan. I'm sure Dr. Gayatri is a proud teacher now. Her, trainees are doing very well. The most important thing is the way you do the work in Vavuniya is so amazing. It's so much inspiration for me to come back in Canada and treat my patients. So thank you again, Dr. Madhurahan. And let me invite Dr. Kaushikan from Jaffna district. He's another amazing physician. Here we go, Dr. Kaushikan.
Thank you, sir. Good evening, everyone. I'm Dr. Kaushikan, working as a medical officer in Trial Cancer Hospital, and me and Dr. Madhuragan got the palliative care training in MNJ Hyderabad and under Gayatri Madam. And following that, we have started our palliative care services in the Jaffna district. And first of all, I would like to thank you all for the thank you all for giving the wonderful opportunity to share my experience with you all and regarding the palliative care services in Northern Province. And after returning from Hyderabad, we started our palliative care outpatient clinic immediately, and that was in the 2018 October. And following that, we have started our palliative care home-based care training, home-based palliative care provider in February 2019. Since then, we have treated almost more than 250 patients until 2020 this month. And 2019, 92 patients we have treated, and 2020 around 100 patients, and following that up to now 2022, 32 patients we are treating. And most of the most of the time we are going and seeing the patient in their home, and in weekly thrice, and 2 doctor visits and 1 nursing visits, and other things almost same as Vavuniya, that we are providing that outpatient clinics and as well as home-based palliative care. And as a palliative care doctor, I just want to share my thoughts regarding being a palliative care physician. Actually, that as a palliative care doctor, my goal is simple: it's to make sure that we treat our patient as a people, not just like a cancer or the CKD patient or just like a stroke patient, but as a unique individual and storied people that they are, and people with their own goals and values, people with their own definition of what it means to life, and even as they are approaching their end of life. And also that we meet people and get to know our people, and we try to find out what gives their lives meaning and what they champion in life, what they cherish, but also that hate and fear. We respond to their emotions. We listen to them, and not to force anything, but we just listen to them, and we just want to make sure that we also whenever no one is there for you, we are there for them, and we help and create medical plans based on each person's unique goals and values, not based on their stereotype or generosity. So this is the this is what I have learned through all these 2 years of doing the palliative care. So it's my pleasure to work as a palliative care provider in Northern Province, and I really thank for this opportunity, and I really thank our mentor and our teacher, Dr. Gayatri Palat Madam, for giving us a wonderful opportunity to learn and help our people regarding the palliative care needs. And thank you very much.
நன்றி டாக்டர் கௌசிகன். உங்கள் சேவை நாட்டுக்கு தேவை என்பது ஒரு மிக சிறிய வாசகமாக இருந்தாலும் உண்மையிலேயே நாங்கள் மனம் உணர்ந்து சொல்லக்கூடிய அந்த வாசகம் வந்து உண்மையிலேயே நீங்கள் செய்யும் சேவை, அதாவது உங்களது வேலை முடித்த பிறகு நீங்கள் செய்யும் அந்த சேவை, சனி ஞாயிற்றுக்கிழமைகளிலே இந்த நோயாளிகளுக்கு ஆறுதல் தரும் இந்த சேவை வந்து உண்மையிலேயே கடவுளுக்கு செய்யும் சேவை. நன்றி டாக்டர் கௌசிகன். Next item is, let me welcome, people are so much praiseful of this person. I don't know what's the secret behind her charm, or is it the teaching, or let me introduce this person. She's an associate professor, pain and palliative medicine at the MNJ Institute of Oncology and Regional Cancer Center in Hyderabad. She was instrumental in establishing the Department of Palliative Care within the institute by developing clinical services, including outpatient, inpatient, and home-based care and training programs. She is originally trained as an anesthetist and is a diplomate of the National Board of Anesthesiology of India. She also has a diploma in international palliative care leadership from the Institute of Palliative Care Medicine, San Diego Hospice in the United States. Please welcome Dr. Gayatri Palat. So she's going to actually play the video of our good friend, Dr. Jonathan Pierce of the Two World Cancer Collaboration. And she's going to take over and introduce the main speaker of the day today. Here we go, Gayatri, all yours.
Thank you. Thank you very much, Dr. Mahadevan, for the kind introduction.
Hi, everyone. I'm Jonathan Pierce. I'm a palliative care physician.
So I really want to congratulate all the organizers for going ahead with this. This we have been planning for quite some time, and finally it is happening. And many of you are, I know that in the background, we have worked hard to make it happen. And I also see Dr. Suren who has joined. So what we'll do now is I'll give this message on behalf of Dr. Jonathan, who is the main course director for this course, and he's representing Two World Cancer Collaboration. And after that, I'll invite Dr. Suren to give the course outline, if that is all right.
Yeah, absolutely. Welcome, Dr. Surendra Kumar. We'll play Dr. Jonathan Pierce's greeting message. Then we can invite you to, give an outline of the course. Thank you so much again.
Thank you.
Right.
I'm Jonathan Pierce. I'm a palliative care physician here in Vancouver, Canada. I've been involved with Two Worlds Cancer Collaboration over the last several years and helping with palliative care training in Northern Province over the last several years, and really looking forward to meeting you all over the coming weeks and months. I think I may have met some of you earlier this year in our introductory session in January. Glad you're able to start with this first session and getting an overview of the course and palliative care in Sri Lanka and as a discipline generally. And I'm sorry I'm not able to be there today live with you all, but I look forward to joining you in future sessions, and I'll be joining you for several of your Saturday sessions over the next months. So take care and welcome to the course.
Thank you very much. I think it was a little shaky from our side, the internet connection. And Dr.
It was perfect.
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 Okay. Thank you. Thank you. And now I invite Dr. Surendra Kumar to please give us tell us about the course outline, how it's going to look like. Over to you.
Yeah, thank you, Gayatri. I'm sorry that I had another work because of this COVID situation here in Jaffna, and then deciding the university activities as planned. I am not able to join from the beginning, So then actually we are planning, this is a certificate course that what happened that earlier, Madragan and Kausigan, even I also actually, I was actually got the training from Dr. Suresh Kumar's place, Calicut, and supported by the KM UK to get the certificate course in palliative care. A similar kind of course, what we did for Madragan and Kausigan and other. I think that.
I think somebody. Dr. Suren, you have to unmute and start again. Let me request everyone to kindly mute their microphones. This usually happens. So go ahead, Dr. Suren.
Okay. So then actually we started the home-based palliative care in Jaffna district and the Vaunia district, and but then we want to expand that further to Mannar, Klinachi, Mullaitivu. But then we need a team of medical officers and nurses to go and do the services. So then we thought to get initially, I think that Dr. Kediswaran would have mentioned, that to train only a couple of medical officers from each district. But that later, because of the COVID, we were not able to send to Hyderabad. Then we thought to convert this as a kind of an online course. So then usually the course is like a 6 weeks course. But at this time, we want to have it as a first theoretical, and the theoretical means that with some assignments and also clinical case discussion. That course will spread out for 6 months. So then after the 6-month course, then we will try to find out this clinical posting, then working with in the hospital setting and also community setting. So then this 6-month certificate course really offered to with this dual cancer collaboration with Hyderabad MNA center. So they are the certificate offering body. So we are planning to have 2 sessions per week. So then one session in the afternoon and another session in the evening. So then every Wednesday, 3 to 5, then in the afternoon, then that we thought that all the doctors and nurses after their duty, they could able to join to these sessions. And also another session, we want to have it in Saturday night, evening, because we want to get international teachers also involved. Particularly today we got Jonathan and his team from Canada and North America. Because of the time difference, they can't join as a resource. So then we want to accommodate these international resources also to come and teach other than the team from Hyderabad and India also. Then Gayatri, Vinila both worked hard and to find out the faculty. So then they will share the faculties, those who are going to involve in teaching. Then already we have decided. So some of the sessions we are planning to do it for the nurses and doctors together, and some of the sessions we will have it in separately for the nurses and doctors. And also that there's Zoom technology is allowing us to work you in the groups and break down breaking rooms and all these things. Then we can use that technology, and then we are planning to uh, assign task and then work in the group. So that's a way then we want to apply different teaching learning methods to offer the course. So I hope this course will very helpful, and also you will get a kind of a very valid internationally valid certificate. So then at the same time we are expecting you to support us, that actually now we want to expand and strengthen the palliative care services in northern province. So then we should able to offer not only the community palliative care, we should be able to offer the hospital-based palliative care and hospice-based palliative care. So then hospice-based, actually, at the moment, we have one hospice in Maranamadam that run by Kane, but we need to expand that in more. So then when we have more and more medical officers and nurses, those who are trained, and we could able to offer then very good palliative care services for our people in Northern Province. If you have any doubt related to the course, then after the Dr. Suresh Kumar's presentation, we could able to update more, and also our course coordinators, is Vinila and also Krishna Kumar from Sri Lanka. So they will update all the materials and relevant thing, and also we will upload the relevant materials and thing through your email communications. And also we want this you somebody volunteer to coordinate this course with us, and then that would be kind of a good thing. And also we want to get the feedback from you that after the sessions, and there are feedback forms. So I hope that you will really enjoy and then and have a good time when you are with us. Thank you.
Thank you, Dr. Suren. That was an awesome introduction. இங்கு நான் குறிப்பாக சொல்ல வர வேண்டிய என்றால் டாக்டர் சுரேன் அவர்கள் சொன்னார்கள் ஃபீட்பேக் என்றது வெரி வெரி இம்பார்ட்டன்ட். ஏனென்றால் உங்களது ஃபீட்பேக்கை வைத்துத்தான், அது நல்ல ஃபீட்பேக்காக இருக்கலாம், இல்லது இல்லை நீங்கள் இப்படி செய்யலாம் அப்படி செய்யலாம் என்ற ஒரு ஆலோசனையாக கூட இருக்கலாம். அப்போ கட்டாயம் எங்களுக்கு ஒவ்வொரு நாளும் அந்த ஒவ்வொரு கோர்ஸ் முடிகிற தருவாயிலே ஃபீட்பேக் வந்து நீங்கள் எங்களுக்கு உண்மையான நேர்மையான ஃபீட்பேக் தந்தால் மிகவும் நன்றாக இருக்கும். காயத்ரி, over to you again.
Thank you very much. And now, with the permission of all the course directors and all the dignitaries who have joined us today, we officially like to start the course. And the first session which we are going to do for this 6-month certificate course is Introduction to Palliative Care. So we've been hearing about so much about this, the terminology which we have been using so often, palliative care. So let's understand the philosophy and what it means when we say palliative care for people with life-limiting conditions. And to do that, we have a very esteemed speaker who's joining us today, Dr. K. Suresh Kumar. And it gives me real pleasure to introduce Dr. Suresh Kumar because he also happens to be my teacher and my mentor. And so, Dr. Suresh Kumar, I hope you're. Yes, thank you, Suresh. Yeah. So, a brief introduction. Dr. Suresh Kumar is the director of WHO Collaborating Center in Community Participation in Palliative Care and Long-Term Care, Calicut. He's also the course director, Fellowship in Palliative Care, a very popular course which is actually happening now. It's an ongoing course. He's the founder director of Institute of Palliative Medicine. He's an Ashoka Global Fellow since 2011. He's active in palliative care scene in India and abroad for the last 27 years. So that's the reason that he's teacher and mentor to so many of us here in this region of the globe, I can say. Part of the team which developed community-based palliative care system in Kerala. Many of you must have heard of this, what we call it as Kerala model, and he's one of those pioneers who started this movement in Kerala. He held many faculty positions in different universities in United Kingdom, Australia, and Thailand. He's involved in developing community-based palliative care projects in multiple sites in India and abroad. His special area of interest, developing palliative care in low and middle-income countries, community participation in palliative care. I'm also aware that he is involved with the Sri Lankan Strategic Planning Group. He's a part of the committee there. So over to you, Dr. Suresh Kumar.
Thank you. Thank you, Gayatri, for that introduction and also for the opportunity. And I'm very happy to be here today because as some of you have mentioned, I've been in some way involved with the Sri Lankan community.
Suresh, we can't hear you. Can you speak a little loudly?
Yeah, is it clearer now?
Yeah, perfect. Thank you.
Okay, that must be my mic. Okay, so I was saying that I'm very happy to be here today because I've been involved with some of the activities and in some way with the Sri Lankan palliative care scene for almost 20 years now. started with my association with Kane while I was working in UK in 2000. And later also like last 10 years, I've been sort of intensely involved with some of the training programs in Sri Lanka, Sweden knows. And also from the government side, like I was privileged to do 2 assessments, national assessments and recommendations of the Sri Lankan scene on International Atomic Energy Agency as mission requested by the Sri Lankan government. The last one was just before the pandemic. So happy to see Dr. Janagi also here. Happy to see both the government sector and the NGO sector working together on this. And actually, like the Palliative in Sri Lanka has, over the last few years, it has actually grown enormously, and it is showing it has shown a visionary approach in both the policy level and also at the primary healthcare level. The initiatives that are being taken up by the government, and also the collaboration from the non-governmental sector has made it like this is likely. I've been in some of these international fora, like even the WHO CRO fora, we have been suggesting that okay, Sri Lanka will be the lead in this region, because there's a very solid policy background that's being developed, and training programs are coming up, and formal training also coming up. So it's the right time to start a course for like this for the Sri Lankan healthcare workers, and happy to see this happening, and thank you very much for inviting me. What I'm trying to do, I have few slides with me. So what I'm planning to do is actually very, very practical approach, because these are people who will be seeing patients in future. These are people who are not just academics. These are people who will be in the field. So many of you know what palliative care is. Many of you have approached this from an academic point of view. What I'm trying to do in the few slides to follow is actually to look at it from a very practical point of view. What do we do? How do we do? What do we need? Can I have the next slide, please? Yeah, now click it once again. So what's palliative care? It's actually, when you summarize it, it's actually an appropriate medical and supportive care for patients whose medical conditions cannot be reversed. I'll come to the formal WHO definition later, but this is what it is. What is appropriate for that patient when you cannot cure? That is the question. Next. Yeah. And from the medical perspective, something that I want to emphasize again is that this is nothing but good ethical medical care, which can give maximum benefit to the patient in the given situation. When the patient situation changes, we also need to change our approach. So this is what it is. It's only ethical medical care. What should the patient get? Ethically, what should the patient get ideally? Next one. Yeah. So it's an exploration of what can be done to help people in the final phase of their life. The final phase can be sometimes days, sometimes weeks, sometimes years. So what can we do to help them? And from the healthcare system point of view, this is something again that I want to emphasize. It's not in conflict with conventional medical care. There is no curative care versus palliative care argument. There is it's not something like palliative care in conflict with curative care. When the patient needs curative approach, we need to go for the curative approach. When the same patient needs a palliative care approach, we need for the palliative approach. It's not saying that, okay, this is again. So this is it's not in conventional care, or not in conflict with any recent advances in medicine. And we are not denying any recent advancements in any technology advances. But we are all that we are saying that it should be in line with the professional commitment to do what is best for the patient. Next slide, please. Yeah. So this is to make it clear. I put one more slide there, because the patients, what is best for the patient changes from time to time. It depends on many factors: status of the disease, life expectancy of the patient, possible result of the proposed intervention, impact in terms of quality or prolongation of life. Can the patient and family afford the proposed intervention? So a lot of factors need to be when you decide what is ideal, when you reach on something like which is ideal for the patient in the situation. So it's very dynamic. It changes as the condition changes. It changes as the patient. Having a good technology, having high technology, does not mean that this is applicable to everybody. You need to use your discretion. You need to use your ethical sense. You need to look at what would be appropriate for that patient. Yeah. Next one. So this is a standard definition, WHO definition. Basically, I projected only to say that this is basically looking at the prevention and relief of suffering. This is probably only one definition in the medical field which talks about suffering. We are not talking about any diagnosis. We are not talking about any pathology. We are saying that life-limiting illness, life-threatening illness, and prevention of suffering. So this is a very broad agenda. When you talk about suffering, it's not just a single thing. That's like, for example, if you're talking only about a pathology, if you're talking only about a tumor size, if you're only talking about a diagnosis, things are different. But when you say that the aim is to prevent and relieve suffering, this is a big agenda. Yeah. Next one. And when you look at the need, again, I projected this slide on this is a 2020 World Atlas Palliative Care, published by WHO and World Hospice Palliative Care Association. You can see that it's not mainly to say that this is not just for cancer. You can see that 28% is cancer, 12.2% of people who need palliative care are people with dementia. Then as a stroke, cerebrovascular diseases, 14.1, 22.2% HIV, various other diseases. So we have to keep in mind, historically, there was a time when people equated palliative care to advanced cancer. Not anymore. People will like, because the disease can be multiple, the diagnosis can be many, but there is a role. Yeah, next one, please. Next slide, please. Yeah. So roughly there will be around 400. When you look at the population, for every 100,000 people, there will be around 400 people in need of this sort of care. This is the rough projection. Guesstimate. We don't have actual estimates from many regions, but the projection is that 377 adults over the age of 15, and then 69 of them, 9% of them are over 60 years old, and then 63 children out of every 100,000 children. So roughly around 400 people would be needing that care. Next one, please. Next slide. Yeah. So when you look at the individual patient, it can be in a different time frame. It can be weeks, months, or years. But this is customary to classify the problems into 4 broad domains. One is the physical problem, pain, breathlessness, etc. Social problems, financial issues, social isolation, etc. A lot of emotional problems, sadness, anger, worries, anxiety, and spiritual issues, whether you're religious or not, something to do with why should you continue to live? It's a question that many people ask. So these are issues, and when you look at suffering, when you say that you are trying to prevent suffering, when you are trying to relieve suffering, these are the main issues in there. These are the main domains in which you have to have a look. You will have to address all the 4 domains to make sure that the patient is more comfortable. Next one, please. Yeah. So this is again something that because most of us, I think the whole group is from medical field or the healthcare field. We need to remember that non-medical problems can be addressed only through intervention outside the healthcare domain. The healthcare system, even the primary healthcare system, may not be able to address all the problems. So we need to think beyond the healthcare system, because end of life, dying, and bereavement, they're all psychological and social experience also. They are not just medical problems. And so palliative care, that's the palliative care extends beyond conventional healthcare. We need to think beyond conventional healthcare. Next one, please. Yeah. So the one question, ultimately, whether you are a healthcare professional, you are the patient's family member, whether you are a patient's neighbor, a well-wisher, whatever you are, there's only one question when you're facing a patient with incurable disease. Since you cannot cure, the only one question, and the question is, how can I use my skills and knowledge to reduce his suffering? What are my skills and knowledge, and how can I use them to reduce this person's suffering? That is the only question. Next one. Next slide. Yeah. So I'm taking this question to the group as healthcare professionals, healthcare workers. What can we as healthcare professionals do to help this patient, somebody with all these problems? Well, the first thing is, let's not abandon the patient. Like, let's not say that there is nothing else that I can do to go home and suffer. No, there are a lot of things that we can do. For one thing, like for some medical sciences, I know how to address the difficult symptoms, but we should learn how to do that. We should know how to apply that. And there are also validated ways of offering psychological support to patients and family. These are available. Many of us might not have learned it during our medical school or nursing school, but this is important that we learn these skills. We update our knowledge and skills so that we can intervene. We can help the patient. Next one. Yeah. So when you look at the list of problems that there I have, this is a paper from UK sometime back, and then you can see that last 1 year of life, whether this is cancer, heart disease, or stroke, they have similar symptoms. There may be some variation in the percentage of people having one particular symptom, but there are some common symptoms like pain, breathlessness, nausea, vomiting, difficulty swallowing, and some of them are more common in cancer, some of them are more common in heart disease, some of them are more common in stroke. But the point that I'm trying to make is that there are certain symptoms which are common to all of these patients, which we need to know how to handle. Next one. Yeah, Jangi was asking whether this presentation can be shared. Yes, Jangi, please. Yeah, I can send it to you either, or Gayatri will send it to you. Yeah. The basic question is one issue is that whether the disease is incurable or not, we should be able to control symptoms. I cannot say that, okay, I'll treat symptoms only when the disease is curable, or I cannot tell the patient that I have not learned to treat a symptom when the disease is incurable. So this is our competence, this is our skill, our knowledge. We should know how to treat pain, how to treat nausea, vomiting, fungating wounds, bed sores, incontinence, confusion. These are not particularly difficult symptoms. But we need to update our knowledge, sharpen our knowledge and skills, so that we can be applied. This is one important thing we talk about palliative care by the healthcare professional. Next one.
Losing out somewhere, like your voice is fading. Sorry.
Yeah, okay. So better now, no? Is it better now?
Yeah. Thank you.
Okay, so I was saying that whether this is curable or not, that's not the condition. Your skill, you need to develop your skills and knowledge to treat the symptoms. If you do not have it, we need to update it. Yeah, next one. And also, like the another one. This is a very important competency from the part of any healthcare worker. Patient and family should not suffer because the doctor or nurse has not learned how to talk. This is happening. This is happening very frequently. The doctor does not know how to break a bad news, or the nurse does not know how to address an emotional problem. And at the end point, the consumer side, on the other side, the patient suffers. This is our incompetence. This is actually, we should see this as our competence, so that we need to learn how to talk. We need to learn how to emotionally support the patient so that the patient and family does not suffer. Next one, please. Yeah, and again, like I was mentioning, like we cannot do it alone. Like this is, problems are complex. A doctor or nurse or a hospital will not be able to address them all. We need to seek help from others. Many of the problems are of a non-medical nature. Social issues, spiritual problems, they are also part of the package. And the local community can play a major role in addressing these problems. Can we have the next one, please? Yeah, why involve the community? There are many reasons for involving the community. We know that most of these patients, even if there is a very good palliative care unit in the region, even if you have a good home care unit, even if you have a good inpatient unit, most of the time the patient will be spending with the family members, neighbors, and other people, well-wishers, old classmates, friends. So most of the care is actually being delivered by them. So we need to take them into confidence. And also, secondly, these people also have common interest in patient. These people also are looking for the patient being well. The well-being of the patient is a common interest for not just for the healthcare team, but for the patient, family, for the neighbors, for the other people also. And also more important, particularly in places like Asian countries, in Sri Lanka or Kerala or India, these are the people who would really advise the patient and family on what to do. They advise on them on what to do, when to seek professional help, where to go for it, whether to change the doctor or the unit, whether to change from modern medicine to Ayurveda. So all these are actually the decisions by the patient and family are influenced by the local community, the neighbors, friends. And so we need to work hand in hand with the community. Without that, we will not be able to deliver what we want to. Next one, please. Yeah. So if you identify 4 core competencies, when you develop a course, end of the course, I think that these are the 4 core competencies that you need to develop. One, people attending the course should know how to diagnose and treat symptoms effectively. Second, you should know how to talk to an emotionally disturbed patient and offer support. Thirdly, you should know where to get social help for the patient. They vary from places to place, they're locally. And you should know where to get spiritual help for the patient. So these are the four minimum core competencies that any healthcare worker sort of handling or managing patients with advanced diseases should have. Next one, please. Yeah, so this is my concluding slide. So my message again in the course, and my message to the prospective for the healthcare worker, whether you want to become a full-time palliative care doctor or palliative nurse is immaterial. Whether if you are seeing patients, and if you have some of these elderly people, some of these people with advanced diseases, some of the people at the end of their life as your patients, you need to have these two skills urgently and minimally. And you should know how to manage major symptoms like nausea, pain, vomiting, breathlessness, fungative wounds, whether the disease is curable or not. And you should know how to communicate well to the patient in a supportive way. These two are minimum skills for any doctor or nurse, not necessarily somebody who is involved in palliative care. This should be. So I think the focus of the course, I'm sure, would be on developing these skills and developing the attitude and developing the minimum competency for the healthcare worker, so that when they see a patient, they should know what to do, whether the patient is curable or incurable, whether the patient is at end of life, whether the patient is dying. As a healthcare worker, I should know what to do. Next slide, please. Thank you very much. And this is my email address, and then I'll be very happy to respond to your queries or supplement with some of the material that you need and all. So thank you for inviting me to present this, and thank you to be part of the group. Thank you very much.
Thank you, Suresh. Excellent overview. We'll take questions now because we still have some time. We can take questions. And also, but I expect that I'm hoping that Suresh, you will help us later on when we have more case-based discussions. We'll be inviting you to help us with some more interaction.
Definitely.
Yeah. Thank you. And also, we have a specific session on community participation, and we'll be once again meeting you in the taking your input for the discussion. Thank you. So
thank you so much, Dr. Suresh. It was so awesome and amazing presentation. I am planning to steal some of those points to teach my students here in Canada. So thanks, it was very inspiring. இப்போ யாருக்காவது கேள்விகள் இருந்தால் நீங்கள் வந்து தமிழிலும் கேட்கலாம் அல்லது ஆங்கிலத்திலும் கேட்கலாம். தமிழில் கேட்பவர்களுக்கு நான் டிரான்ஸ்லேட் பண்ணலாம். If you have any questions, this is the time. We have so many experts here, Dr. Suresh Kumar, Dr. Stuart Brown. There's so many experts here. Please throw your questions. I see a lot of familiar faces. Kulanda Yesu irukrar, Dr. Jayarasa irukrar, ellarum therindavargal. If you have any questions, this is the time to ask.
Before we start, Suran, will you be happy to forward my slides to Janaki? For Janaki to the topic.
Yeah, I will do. I will do.
கோவலராஜா, நீங்கள் கேள்வி என்ன கேட்க போறீங்களோ?
இல்ல சார்.
இல்ல, right. Any questions? So if we don't have any questions, I think we can move on to the next item on the agenda is the customary vote of thanks. Let me invite Dr. Surendra Kumaran to give the customary vote of thanks. Dr. I think you guys had a power failure there. Suddenly everything went off and it is a power, really.
Yeah, my side, I don't know what with the others. From my place, I got the power failure in between.
So, குழந்தை and கோவலராஜா, உங்களோட மைக்கை வந்து மியூட் பண்ணி விட்டீங்கன்னா நல்ல அழகான ஒரு காகமோ கிளியோ கத்துதுன்னு நினைக்கிறேன். Okay.
Yeah. Actually, it's a very difficult part, but then to thanking. So sometimes that we may miss the people, and then people may think. So, but this is kind of a very. We are very proud to say then we are able to get very good faculties today to bring to one place, and then for this inauguration of the course. So there are a lot of background work done by many people to make this event successful. First, I would like to thank particularly the leadership that given by the Provincial Director of Health Service, Dr. K. Swaran, and also this our National Cancer Control Program Director, Dr. Nyanagi Vidanapakarane, then both agree to with their busy schedule and then join with us, uh, and also that from the cancer control program, then the person in charge for this palliative care, Dr. Hirosha, also is here. So then all of them to come here that for the inauguration and their support. And I hope that in the future, then their support is very important for us to continue this effort to improve the palliative care services in Northern Province. So thank you very much for their involvement. And then very important collaborators here with the government is Two World Cancer Collaboration. So then particularly we got Dr. Stuart Brown is from New Zealand, and then that I think is actually now is getting late for him, but although then he wanted to join for this inauguration. And then main coordinator of this course, Dr. Jonathan, unfortunately he couldn't join today. For him is a midnight, so then so the time difference. So then he couldn't join. So then we have to thank for the Jonathan for all the effort with us, particularly with the Gayatri team and our team. So then working tirelessly to make this event real. Then we need to thank uh, Dr. Kamala from Kent, UK, and they are the founders of these palliative care services in North. Particularly, I am very proud that actually having Dr. Suresh Kumar here. He has a long-standing relationship with all of us, and then on the cane. And also, I am one of his trainee that I got this palliative care training under his guidance and his institute. So then Dr. Kamala actually agreed to join and then explain this how the palliative care services initiated and ongoing. So thank you for the time. Then we have a very important collaborators, International Medical Health Organization Canada, and then really then Dr. Varakunan and Dr. Meera, and all that last more than now it's more than four years. We have been working together to develop this community-based palliative care in Northern Province, and then we are able to deliver that. Without their support and their actually each and every steps, their contribution is very helpful to make this course and the services for our people. Then very important, and then having Dr. Suresh Kumar and his talk, and then he's a very simple and dynamic and expert in the palliative care, and his experience in palliative care, nobody can get into that, and he's dedicated his time to full time for palliative care. So getting him to deliver this first lecture is a very wonderful, great opportunity. Thank you very much for agree to be here with us to provide the lectures. And then we have to thank Kausigan, Maduragan, and their team, the palliative care team, and what they explain to these participants and what they are doing and how they are working. So they are help actually is very important in the future also. Then without their support that we can't run this course. Then very important stakeholders here. Actually, Gayatri, Vinila, and Krishna Kumar. So they are the key people here, and they are going to continue this course and coordinate with us. So then I hope that their contribution will make this us to take this palliative care to the next level. And also all the participants here, these doctors and nurses, thank you, agree to be with us to work. And also these particularly that ECHO India agreed to provide their support to conducting these courses and then facilitating our process. So I hope that I am able to thank almost thing. Then if I forgot to mention that not that maybe something that we missed also. So, but that we are very thankful, and also that from the beginning. Then today they are not here. That JMFOA Canada, that Alumni Association Canada, also part of this initiative. So then thank you all for this, make this reality, and then thank you. I think then we could make a move from here to the next level. Thank you.
Thank you so much, Dr. Surendra Kumar. You did an awesome job thanking everyone, and appreciate that. I would also like to thank a few other people who are involved in all our journey towards our, and they are going to follow us here. One is Dr. Meera Rajasekaram from UK. She's been one of our, a resource person. We have a WhatsApp group, and I know we all have, every month we had case presentations and case discussions every month. I think due to the pandemic past 2-3 months, we were not able to have it. We are planning to continue. And we would really appreciate a legend like Dr. Suresh Kumar. Also, we will invite you to share, your great knowledge with us in those case presentations. Thank you, Dr. Suresh Kumar. Another person I would really like to thank is Dr. Krishanti, who is the oncologist working at Telepalli Hospital. She is another resourceful person, and whenever we actually, call her or approach her, she's readily available to give her lots of insights into the palliative care program. And another person, I've already thanked her, but I would really like to mention the name, Dr. Meera Selvakon, who's been a supporter. She's my colleague in Toronto. I would really like to mention an incident. Recently, her father-in-law passed away, and during the pandemic. And what the family announced was, they actually announced a fundraising. Anybody wants to come and honor his death. So people donated on the memory of Dr. Selvakon's, Meera Selvakon's father-in-law, and we collected nearly around 9,000 Canadian dollars. And thank you, Dr. Meera, for doing that. And another two people I would really like to mention. One is already here, Dr. Stuart Brown. He's an awesome person to move with. He's a great friend and a resourceful person. And Dr. Simon Sutcliffe, who is also a very resourceful person and who is very helpful to develop this. Another lady whom I would really like to mention is Dr. Fatim Lada. She's a clinical pharmacist who always, past 2 years, she was with us. She is still with us, joining the clinical discussions and clinical meetings every month. And anytime in the WhatsApp group, one of the doctors say, Dr. Madrohan has a question about a particular dosage or particular medication or a side effect. Fatima is the first person to respond as a clinical pharmacist. So thank you, Fatima. She's not here. They live in Vancouver, so it's 3 hours behind us. So thank you, Fatima. And Dr. Kamala Arunachalam, we are always appreciative and thankful to your service as a Kane president. And thank you so much. She's nicely waving there. Always great to see your smiling face there. And again, I think everybody forgets the host here. I mean, I'm saying two people. One is Surendra Kumar. Surendra Kumar, you know what, he wears multiple hats, but he does everything in a very nice way. I still don't understand how he's managing so much work there. Thank you very much, Dr. Surendra Kumar. Last but not the least, I would like to thank Madhurahan and Gaushigan for your exceptional service. And another person, I mean, we already thanked him many times, Dr. Kediswaran and his teammate, Krishna. Thank you so much, Krishna, for coordinating this. Again, last but not the least, the Hyderabad folks here. Gayatri, without you, I don't know how we're going to move from here. Thank you so much. This is the starting point. We may have more of these 6 months courses or in-person courses in the future. Thank you so much for stepping up. And I think Vinila, who's the coordinator, and I think she's the treasurer. Thank you so much, Vinila, for all the help. And if you have any questions, anyone here would raise it or give a feedback online, please feel free to do that. You don't need to ask a question, but give us a feedback. We can actually conclude after that. Thanks again.
Dr. Vara or Gayatri, do we have any announcements and then things about the course?
So the next session, today was the introduction, overview about introducing the concept of palliative care. The next session is on 8th May, 7:30 p.m., 7:30 to 9:30 p.m. It's on introduction to communication. Remember Dr. Suresh last slide? The core thing which we need to know is about symptoms and communication. So the next session is on communication. And we have a great teacher, another very well-known teacher in the Indian community, Dr. Mallika Tiruvadanan, who's going to be the faculty, of course, supported by many other faculty. I think even Dr. Mahadevan intends to join. So we'll all be doing it together, but Dr. Mallika is going to be the lead faculty, Dr. Mallika Tiruvadanan. And hopefully it will be done in Tamil. So we'll be learning communication skill in practicing in Tamil. Thank you.
Dr. Mallika, she's already here. I see her name here, Dr. Mallika Tiruvadanan. I think Dr. Mallika Tiruvadanan Tamil பேசுவாங்கன்னு நினைக்கிறேன். வணக்கம் Mallika. So நானும் மல்லிகாவும் தமிழ் பேசும் palliative care physicians என்று நினைக்கின்றேன். Let's hear from you, Mallika. தமிழ்ல கொஞ்சம் உங்களது தமிழை எடுத்து விடுங்களேன்.
கட்டாயம் தமிழ்ல பேசுறதுக்கு ரொம்ப ஆவலா காத்திருக்கேன். ஏன்னா முக்கியமா கம்யூனிகேஷன் சொல்லும்போது நம்ம பேசுற லாங்குவேஜ்ல சொல்லும்போது இன்னும் கொஞ்சம் நேச்சுரலா வரதுக்கு வாய்ப்பு இருக்கு. So I'm looking forward to it.
Thank you, Dr. Mallika. Yes, Gayatri. So, do you have any other announcements to make, Dr. Gayatri?
No, for today, this much. And from next time onward, there'll be feedback forms and other things. So end of the session, in the chat, there is a link they've shared. Please give your feedback. I request all the participants, please share your feedback. It will be very useful for us to see the feedback and improve the way we are conducting the course. Please go to the chat. There's a link given and give your feedback. It won't take a lot of time. Just quick clicking on the content.
Yes. And also we have a WhatsApp group. I think all of the participants are in the WhatsApp group. If you're not in the WhatsApp group, please ask Mr. Krishna to add you in the WhatsApp group. And you can anytime ask a question or give a feedback or give your suggestions or comments in the WhatsApp group. We welcome all that so that we can have work as a team. And thank you very much, everyone, for joining us today. I'm sure, I'm very positive that this course is going to be a very successful course, and we'll have a great palliative care service in north and east of Sri Lanka. Dr. Kedis, you have a last word to say.
Yeah, thank you very much again. First, Varagunan, thank you very much for conducting this session. And thank you very much all the speakers. And on behalf of Northern Province, the health sector, and people of Northern Province, thank you very much to all the stakeholders. Thank you.
Vanakkam, namaste, aibowang, and good evening, everyone.
Thank you.
Thank you.
Thank you. Thank you very much.